Welcome to our video on Top 10 Studies on the Relationship Between Heat Waves and Health Risks. As climate change continues to escalate, understanding the health impacts of extreme heat becomes increasingly critical. In this video, we will explore key findings from groundbreaking research that sheds light on how heat waves affect mortality rates, cardiovascular health, mental well-being, and more. Join us as we delve into these important studies and uncover the significant risks posed by rising temperatures, particularly for vulnerable populations. 1. The impact of heat waves on mortality in urban areas. Lancet, 2020. A landmark study conducted by The Lancet in 2020 brought to light the stark reality of heat waves and their impact on mortality rates in urban settings. The research focused on global cities and found that heat waves significantly raise mortality rates, especially among the elderly and those with pre-existing health conditions. This study highlighted the concept of urban heat islands, where concrete and asphalt absorb and retain heat, exacerbating the effects of heat waves. The findings underscore the urgent need for improved urban planning and infrastructure that can better cool cities during extreme heat events. Implementing more green spaces, reflective surfaces, and cooling centers are some ways cities can mitigate these risks. As temperatures continue to rise, these interventions become not just desirable but essential. 2. Global patterns of mortality risk during heat waves. Nature Climate Change, 2018. In 2018, a comprehensive meta-analysis published in Nature Climate Change examined mortality risks associated with heat waves across different continents. The study found a direct correlation between extreme heat events and increased mortality rates, with low-income populations being disproportionately affected. This indicates that socioeconomic disparities play a critical role in determining vulnerability to heat waves. The research also pointed out that people living in less developed areas often lack access to air conditioning or adequate health care, making them more susceptible to heat-related illnesses. This study calls for targeted public health interventions that address these inequalities, ensuring that vulnerable communities receive the support they need during heat waves. 3. Heat waves and cardiovascular risks. A systematic review, Environmental Health Perspectives, 2016. Heat waves pose a significant threat to cardiovascular health, as highlighted in a systematic review published by Environmental Health Perspectives in 2016. The study found a strong link between extreme heat and an increase in cardiovascular events, such as strokes and heart attacks. People with pre-existing heart conditions are particularly at risk during these periods. The physiological stress caused by high temperatures can exacerbate existing cardiovascular issues, leading to severe health outcomes. The findings emphasize the importance of targeted health interventions during heat waves, such as public health campaigns that educate at-risk populations on how to stay cool and hydrated. Healthcare systems must be prepared to respond to the increased demand for medical attention during these times. 4. Association of heat exposure with kidney disease. Journal of the American Society of Nephrology, 2019. The Journal of the American Society of Nephrology published a study in 2019 that explored the connection between heat exposure and kidney disease. The research concluded that chronic heat exposure and dehydration significantly increase the risk of kidney injuries, particularly among outdoor workers. This finding is particularly relevant for regions with high temperatures where outdoor labor is common. Occupational health policies must adapt to these challenges by implementing measures such as regular hydration breaks and providing shaded areas for rest. Employers and policymakers need to recognize the risks posed by heat waves to workers' health and safety, ensuring that protective measures are in place to prevent heat-related kidney issues. 5. Heat waves and mental health outcomes. World Psychiatry, 2021. The link between extreme heat and mental health outcomes was explored in a study published in World Psychiatry in 2021. The research found that heat waves are associated with increased incidences of anxiety, depression, and hospitalizations for mental health crises. Heat stress can exacerbate existing mental health conditions, leading to heightened distress and a greater need for mental health services. This study highlights the broader impact of heat waves on health, extending beyond physical ailments to encompass mental well-being. Healthcare systems must take an integrated approach to address these challenges, ensuring that mental health support is part of the response to heat waves. Public health strategies should include awareness campaigns that encourage individuals to seek help if they experience mental health issues during extreme heat events. 6. Heat-related mortality in Europe. Trends and Projections, Environmental Research Letters, 2017. A 2017 study published in Environmental Research Letters examined trends and projections of heatwave-related mortality in Europe. The research revealed that deaths associated with heatwaves have been on the rise and are expected to worsen due to climate change. This study serves as a wake-up call for European nations to implement urgent adaptation strategies to mitigate future health impacts. These strategies may include enhancing early warning systems, improving public awareness, and investing in infrastructure to better withstand extreme heat. The findings underscore the need for proactive measures to protect populations from the deadly effects of heat waves, particularly as climate change continues to pose significant challenges. 7. Child Health and Heatwaves, Pediatrics, 2019. A study published in Pediatrics in 2019 focused on the vulnerability of children during heat waves. The research found that children experience higher rates of heat-related illnesses due to their inability to regulate body temperature effectively. This makes them particularly susceptible to conditions like heat exhaustion and heat stroke. The study calls for heatwave response plans that prioritize the protection of children, especially in schools and communities. Implementing measures such as providing adequate shade, ensuring access to water, and adjusting outdoor activities based on temperature can help safeguard children's health during heat events. Recognizing the unique needs of children is crucial for developing effective interventions that reduce their risk of heat-related health issues. 8. Heatwaves and Respiratory Illnesses, American Journal of Respiratory and Critical Care Medicine, 2018. The American Journal of Respiratory and Critical Care Medicine published a study in 2018 that examined the impact of heat waves on respiratory illnesses. The research found that extreme heat exacerbates respiratory conditions like asthma and COPD, leading to higher rates of emergency visits and hospital admissions. This is particularly concerning for individuals with pre-existing respiratory issues, as heat can worsen symptoms and trigger health crises. The study emphasizes the importance of air quality monitoring and targeted care to reduce heatwave-related respiratory risks. Public health strategies should include measures to improve air quality and provide support for individuals with respiratory conditions during heat events. 9. The Effectiveness of Early Warning Systems for Heatwaves, Science Advances, 2020. A 2020 study published in Science Advances evaluated the effectiveness of early warning systems for heat waves. The analysis demonstrated that regions with effective public health messaging and preparedness experienced reduced mortality and morbidity during extreme heat events. Early warning systems play a crucial role in saving lives by enabling timely interventions and informing the public about the risks of heat waves. The study highlights the importance of investing in these systems to enhance community resilience and preparedness. By providing accurate and timely information, early warning systems help individuals and communities take necessary precautions to protect themselves from the dangers of heat waves. 10. Heatwaves and Vulnerable Populations. The Role of Age, Gender, and Income, Global Environmental Change, 2015. The role of socio-demographic factors in susceptibility to heat-related health risks was explored in a 2015 study published in Global Environmental Change. The research found that age, gender, and income level significantly influence vulnerability to heat waves. Older adults, women, and low-income populations are particularly at risk due to various factors, including limited access to resources and healthcare. The study underscores the need for tailored interventions that address these disparities, ensuring that the most vulnerable populations receive the support they need during heat events. Public health strategies should focus on providing targeted assistance to these groups, helping to reduce their risk of heat-related health issues. These studies collectively highlight the pressing need for climate adaptation policies, healthcare system improvements, and social interventions to reduce heatwave-related health risks.